Hey everybody, this is Dr. Monica Du. I'm going to be talking today about ear infections. That is one of the most common complaints that pediatricians receive pretty much all the time. Ear infections can affect many of us. It is often said even that by the time a child is 3, they probably will have had an ear infection at some point in their life. Some people, unfortunately, too, can get pretty recurrent ear infections that cause them to be seen by specialists to get special care for it. But for an average child, they can get a few ear infections throughout their lifetime. There are 2 different types. The most common one that we have to deal with in the office is the middle ear infection. That's called otitis media. The second type is the external ear infection or infection within that ear canal. That's called otitis externa. And that is usually also called swimmer's ear. People can get that if they've been in obviously a condition where they've been swimming, and sometimes bacterium can get introduced there and cause swelling and lots of pain. That one is usually older children though. I would like to focus though more on the otitis media. That's the one that you'll usually kind of see your children facing, especially the smaller ones, and the infants usually have to deal with that. So a middle ear infection is often going to be prompted by some rubbing on the ear. They might, of course, obviously, if they are able to tell you what's going on, they're going to say their ear is hurting, or they might feel like they're not hearing very well, just feel like some odd sensation to the ear. And then, of course, it can be associated with even fever, even some very high fevers at times. When that ear infection is troubling children, it can develop. So how does the ear infection come about? Most oftentimes it is heralded by that common cold, that nasal congestion, runny nose. Oftentimes that'll set them up. That's the most time that I see is when children are kind of battling that common cold, and then all of a sudden, there you go, they start pulling on their ear. Oftentimes they had something going on in that nasal passage. That could be even allergies, of course, the common cold. You can even have a sore throat, other things like upper respiratory symptoms that can herald that ear infection. So what happens is that there is something called the Eustachian tube, and that tube is a connection between our nose, the upper throat, and then that ear drum. So that is what is used to help to balance the air on the outside with the air on the inside. And sometimes even you might feel a popping sensation. That is that Eustachian tube that might not be functioning very well. And that is why you feel kind of a little discomfort or kind of a popping sensation sometimes you might feel. So when that Eustachian tube becomes affected by fluid that is often coming from the nose, or kind of your common cold symptoms, it can go back there. And what happens now? Viruses can get back there, bacterium can get back there, fester, and start to produce pus and inflammatory materials that can then lead to your middle ear infection. And that is when, boom, pain. Oh my goodness, they're in so much pain. It's quite painful. It's even oftentimes you'll see that children are having the worst symptoms at night, because when they lay back, all that fluid pulls back, builds up pressure, and it's just an awful experience for them. So of course we want to go ahead and treat middle ear infections. If we see obvious signs on our exam, then we want to go ahead and treat, especially with the younger infants and toddlers. We want to go ahead and treat that so that it doesn't progress into a worsening condition, and so that it doesn't affect their hearing long term, and so that, of course, obviously they resolve the illness, and so that they can finally get rest and sleep and be cleared of that infection. So in addition, I wanted to go ahead and show you what we look at with our tools, with our otoscope. What exactly is your doctor seeing when they look in the ear? So I'm gonna go ahead and see if you could look at this. This is just a little picture that I have. It's from the Pediatric Journal. Very good reference to use. So this one, A, is how the middle ear looks normally. It kind of looks like a concave formation, almost like a cup, nice and translucent, can see through there. No pus, no redness, no streakiness, no bulging, no retractions, just nice and normal, nice, cool and calm middle ear. And now B is that eardrum again, but now it has mild bulging. So it's red, there's some inflammation there, there's red streaks. That is not nice and clear. It's not normal anymore. Now C is progressing onwards to even worsening material behind that eardrum. Lots more pus back there, and now it's starting to, bam, come out at you. It's bulging a little bit. There's a distortion of what we call the landmarks in the ears, which are the normal little organs that you see in there. You're not seeing it clearly anymore like you saw in the first one in A. And then D is at your severest point. That's at a pretty bad ear infection. Is so bulging outwards at you. Lots of pus filled back there. Now, can you imagine that in that poor little child? That's why they're in so much pain. It's so swollen. Lots of pressure back there. So what we do for the treatment for ear infection, of course, is antibiotics. If we see something like this from B through D, we want to go ahead and treat that. Now, sometimes your child might be pulling on their ear, but it does not mean that they have an ear infection. That's why it's so important for the pediatrician to take a good look in that ear. Let them have a good look with their otoscope. They might see something called an effusion. That's just a little bit of fluid that's back there, and might not be associated, is not associated at all actually with any pus, not usually any inflammation, just a little fluid back there, and that will usually resolve on its own, does not need antibiotics. So it's very important that the pediatrician takes a good close look, because depending on what they see, it will determine if you need to give antibiotics. And remember now, not every illness is an indication for antibiotics. And especially, we also take into consideration whether the child is an infant, whether it's a toddler, whether it's an older child, different guidelines based on age, just to let you know. So I hope that that was helpful for you, and I hope that if your little one does have an ear infection, you go ahead and just let them get checked out. You can't tell just by looking. You can't tell by looking on the outside. They really need to be seen by a physician that can take a good look inside and make sure that everything is straight. All right. I hope you all have a great day.